Let everybody in. All right, just waiting for folks to drop into the Zoom. I think we're ready. Welcome everyone to today's budget hearings. Today we are hearing 4 budgets. We are hearing the Department of Disabilities, MIMS, Child Support Services in the Department of Human Services, and the professional boards within the Department of Health. The order is going to be as follows: Department of Disabilities, MIMS, Child Support Services, and then professional boards, which I had just said. My apologies, someone has the gall to walk past our house. We're gonna go ahead and begin. As always, we will start with the analyst report. We will take questions of the analyst. We will go to the department. And then we'll take questions of the department. And then in the case that there are members of the public signed up to testify, we will allow them to go after that and then take questions as necessary. I will say that members of the public are limited because we do have a lot of people to 2 minutes of testimony. We will be timing you, and then after 2 minutes, we will ask you to wrap it up. Finally, as a reminder, this is being live streamed, so everything that is said and done on camera is subject to public record and currently available on YouTube. That also includes anything that goes in the chat. So just a reminder to anyone on the call. We will go ahead and begin with the Department of Disabilities. Let me bring up my and the analyst report from Grace Pedersen. Grace, there you are. Take it away.
Mr. Chair. It's my pleasure to present the Department of Disabilities Fiscal 2023 budget analysis. Getting right into it, the budget increases 7%, and this is mostly driven by Assistive Technology Services and the Telecommunications Access in Maryland program. The Telecommunications Access in Maryland program, or TAM, makes up more than a third of the budget, and the next largest chunk is for personnel, followed by other smaller programs and offices serving individuals with disabilities. Looking at the fluctuation from fiscal 22 to 23, there's some changes in personnel reflective of the department receiving almost 2 new contractual positions. Other fluctuations are due to services for individuals with disabilities, such as housing services and assistive technology services. One of the larger decreases is for the Senior Call Check program, which is funded through the department's Universal Services Trust Fund, which are special funds. And I'll talk later about the Universal Services Trust Fund more. This is look at the department's personnel. There are currently 3 vacancies, one of which has been vacant for more than a year, and the 2 new contracts, the 1.99 new contractuals are mostly related to assistive technology services. Okay, going to the discussion of the Universal Services Trust Fund. So the trust fund is funded by a 5-cent per month fee on telecommunications subscriber bills. So this is telephone or cell phone bills, and those fees are deposited in the USTF, and that funding is then used to support the Telecommunications Access in Maryland program, which provides Maryland relay services to individuals that have difficulty using a standard telephone, as well as that Senior Call Check program that I discussed earlier. Something notable is that the trust fund was transferred from the Department of Information Technology to the Department of Disabilities in fiscal 21. And at that point, services funded through the trust fund really ramped up. The TAM program expanded and started offering some additional services, as well as the Senior Call Check program got off the ground and started incurring expenditures there. So the department estimates that if revenues to the trust fund don't increase and expenditures remain at fiscal 23 levels, it's potential there could be a funding shortfall as early as fiscal 26. So the DLS is recommending to request a report on expenditures from the fund and how the department anticipates accommodating a funding shortfall if that were to take place in the out years. Looking at the next issue is about the Maryland Assistive Technology Reuse Center. So this is a relatively new initiative from the department starting in calendar 2020, and the department accepts donations of high-tech assistive technology. So this could be something like a screen reader and something video magnifiers and things like that. And they'll accept the technology, and then they could either fix it or just redistribute it to the public at no cost. So as of November, the value of the equipment that has been donated to the program and collected in inventory was about $160,000. Data on the expenditures specific to the reuse center was not available at the time of this writing. So DLS is asking the department to comment, indicating the level of expenditures going into the reuse center to make sure this is the most cost-effective means to provide assistive technology to folks. Going to the third issue, this is an update on the statewide IT accessibility initiative. So during the interim, the department submitted a report in response to the JCR, which indicated its plan through fiscal 25 for getting the initiative off the ground and getting state agencies to participate and make their online presence more accessible, as well as prioritizing accessibility in their IT procurements. So in fiscal 22, the department has been developing training and also consulting with DoIT on their managed websites. Something interesting in fiscal 23 is that the department plans to conduct a statewide audit to kind of be a baseline for the state's the accessibility of the state's online presence that could then be used in later years for comparison and whether progress is being made towards accessibility goals. That concludes the issues I have to discuss, and here is that recommendation about the Universal Services Trust Fund expenditures and projected balance in the out years. That concludes my presentation. I'd be happy to take any questions.
Thank you, Grace. Any questions for Grace about the analysis? All right, seeing none from the committee, we will move to the department. And with us, I don't know if all of the folks who are on this list are actually here, so whoever's here, just be here, and then if not, just let us know. But we should have the Secretary of Department of Disabilities, Carol Beatty, the Deputy Secretary, Christian Mealy, the Deputy Assistant Secretary, John Brennan, the Executive Director of TAM, David Behar, and the Executive Director of the TAP program, Lori Markland. So if that is everyone here, Madam Secretary, please take it away.
Well, thank you, Chair Resnick and Vice Chair Valentino Smith and all the members of the subcommittee. And it's great to see Delegate Chang here as well. And thank you, Mr. Chair, for introducing everyone. So I am Carol Beatty. I am the Secretary for the department. And as you mentioned, we have others here to answer questions if that becomes necessary. So we would like to thank our analyst, Ms. Peterson, for her very thorough analysis. And you have our written testimony. So with your permission, I would like to discuss the issues that was raised in the analyst report. So we were asked to comment on our coordination with the Department of Aging in overseeing the Senior Call Check program and its FY23 allowance decrease in funding and the relationship that that all has to the USTF fund balance. The Senior Call Check program, just for a little bit of background, was established by legislation and launched in 2019, and it's managed by the Department of Aging, and we don't have really any authority over that program. The funding, however, for the Senior Call Check program comes from the Universal Services Trust Fund. And as pointed out by our analysts, the fund derives its revenue from a monthly fee to customers for telephone services. So originally, this fund was established to fund alternative communication access services for people who are deaf, hard of hearing, or who have communication disabilities. The USTF currently financially supports programs under our department, including the Telecommunications Access of Maryland program that includes Maryland Relay, the Maryland Accessible Technology Program, and the Deaf Blind Communication Facilitator. It also funds the recently established Senior Call Check program, which is operated, as I said, by the Department of Aging. Our department coordinates with Aging to include the Senior Call Check program cost in our budget request. The USTF currently has a surplus, but as noted by Ms. Peterson, that surplus is declining because of rising costs, evolving customer needs, constantly changing technology, and the addition of new programs, such as our Deaf-Blind Communication Facilitator and the Senior Call Check program. MDOD has the responsibility for monitoring the fund, and we are charged with communicating with the Public Service Commission regarding the cost of services funded through the USTF. Since assuming responsibility for the fund, and in the summer of 2020, MDOD has completed projections based on historical costs and information, anticipated increase in contractual costs, and growth forecasts. All of these services funded by the USTF are legislatively mandated. We have seen fluctuating expenditures due to, as I said, contract changes, growth, and the recent addition of some of these programs. So this has made projecting out the USTF fund future status pretty difficult. However, we do anticipate a clearer picture this year based on actual experience and firm contractual agreements that we're expecting this coming year. The Senior Call Check FY23 request was based on their anticipated needs for the year, and it is not reflective of substantive programmatic changes. The funds requested will continue to pay for the call center, for outreach and marketing, and administrative costs. And we do plan to work with Aging to create a plan to address the USTF revenue shortfalls, and we'll submit that with our FY24 budget request. And then the second part of that was it was recommended that MDOD submit a report regarding its progress implementing planned programmatic changes, data indicating utilization of TAM services, and updated projections of the USTF funds. And as I said, we concur with this recommendation, and as previously mentioned, we'll coordinate with the Department of Aging to prepare the report and to submit it with our FY24 budget request. And then we were also requested to provide an estimate of the Maryland Assisted Technology Reuse Center expenditures in FY22 and 23. And just a background on this, the Department of Disabilities provides the state's assistive technology activities that are funded through the federal AT Act. The Maryland Technology Assistance Program, or we refer to it as MDTAP, operates the newly established MATER program, which receives donation of gently used high-tech assistive technology devices, and that's things like eye gaze systems and video magnifiers and other kinds of communication devices. And this unique program is located at the Howard County Loan Closet, and we're really very grateful to be working in collaboration with Howard County government to make this available. From this centrally located program area, we are able to serve clients from all over the state. Our staff coordinates the repair, refurbishing, cleaning, and clearing of all of the devices that are donated before they go out to consumers who request them. The work is accomplished by building relationships with the private sector, including working with Howard Community College and also volunteers for medical engineering. This innovative program is one of only few that are in use right now or in operation for dedicated high-tech AT equipment across the country. Program operations does not involve any state dollars, and helps MD TAP to satisfy the core equipment reuse activities that are required by the Federal AT Act. Equipment reuse is one of 4 mandated state-level activities that are required for this federal funding. For the MATER program, the federal funds support the salary of 1 part-time staff person who works approximately 16 hours a week on site. Her work includes facilitating all the donations, one-on-one client consultation, and equipment training. The projected federal funding cost for this position for FY 22 and 23 is approximately $32,000 per annum. And there are no other estimated state or federal fund expenditures for this program. So in conclusion, we concur with the recommended operating budget, recommended action to adopt the recommended narrative regarding expenditures and projected balance of the USTF, and will coordinate with the Department of Aging to author this report by the due date. And thank you so much, and we'll be glad to take any questions that the subcommittee members might have.
Thank you for that. Any questions from committee members? Delegate Valentino Smith.
Thank you, Secretary Beatty. And I know things have been particularly difficult for all the agencies during COVID. I think for the last couple of years, even pre-COVID, we've been talking to you and some of the other agencies about accessibility to your websites and what's being done. And I see that on page 9 of the report that we have before us, it doesn't look like you're even going to be doing the in-depth audit until next year, 2023. And just wondering why that is backed up and not being done sooner. And then the second question is, it says that 27 state agencies requested accessibility remediation, and just trying to figure out if those 27 state agencies got the remediation and if they were able to improve their accessibility. And then it says of the 55 that are managed by Do It, 40 are expected to have improved accessibility by the end of 2022. So not that you can answer that today, but it would be helpful for us to understand if the state agencies received remediation and what the remediation resulted in. In other words, was it for non-visual assistance to the website, or for what disability the remediation assisted accessibility, and the same for Do It?
Well, thank you for that question. It's a great question. And I think we can give you some information today and follow it up with more specific information after the committee meeting. And so I would like to actually turn this over to Deputy Assistant Secretary John Brennan to give you a sort of an overview of what's happened in the last year.
Thank you, Secretary Beatty. Happy to provide some information on our efforts over the last year. As the delegate mentioned, it has been challenging given the pandemic and everything that we've had to respond to as a result of that. We have focused our efforts in the last year on assisting Do It with a major initiative that they are in the process of completing. One part of that is to switch over their content management system to the latest version of SharePoint. And then the other part of that initiative is to get all of the state of the sites under their purview under a standard template. So the way that we have assisted them in that capacity was to evaluate the content for all of the sites that are under their purview and provide them with information on what would need to be remediated in order to make that content accessible once it was transferred over to SharePoint. And then the second part was to review the template and make sure that it actually was accessible before they started converting sites to that. Just to give you a sort of a sense of how much work that involves, each site is roughly 30 to 40 pages long. It takes about 3 to 5 business days for our 2 staff to complete a website evaluation and then provide remediation information on that. And between the last hearing and today, we've estimated that we spent about 2,000 staff hours just on that effort alone. And so that's why, in particular, our review of all of the sites under the state's purview, not just DO-ITs, where we set the expectation to complete the baseline report in the second quarter of FY23. We are still, in terms of what has happened related to the assistance that we've provided to DO-IT thus far, the DO-IT staff are currently remediating the sites that they have been provided evaluations for. So those are being brought into compliance with state and federal law. We can provide more information after the hearing as to the exact status of all of those sites. And then we also are continuing to provide ongoing evaluation of the template to make sure that it is still compliant when any changes are made to that. So I hope that answers the question. If you have additional questions, I'm happy to answer those, and then we can provide more information as follow-up after the hearing.
Thank you, Mr. Chairman. I guess just a quick follow-up. In what year, Mr. Brennan or Secretary Beatty, do you expect that the websites will be accessible to the disabled? And I think primarily we were looking at non-visual. I'm assuming that's the primary hindrance for the state websites. What are you sensing is going to be when we have real accessibility beyond what we have right now for the disabled population?
I can answer that question if you'd like, Secretary Beatty. You're right. We are looking primarily at non-visual access because that's the state guidelines that we are reviewing. In terms of saying that all the sites are going to be accessible and predicting when that would be is hard to pin down because it's a moving target. Each time a change is made to a website, it could impact the accessibility. I think we're going to be in a better position to answer that question once we complete the baseline report that we're going to have completed in the second quarter of FY23. And then we can start to gauge when we do reevaluations of those sites and determine accessibility levels, what kind of progress we're making.
Thank you, Mr. Chairman. It's just for years we've been talking about this, and I'm not sensing that we're getting any further ahead. Thank you.
All right. Any additional questions for the department? Okay, seeing none, I'd like to move to public testimony, assuming I can bring up the right document. There we go. We have one individual signed up to testify, Anil Lewis from the National Federation of the Blind. Anil, you will have 2 minutes to make your statement, and I will let you know when that time is up if you need it. So please, by all means, go ahead.
Thank you, sir. Thank you, Mr. Chair, members, honorable members of the committee. Appreciate this opportunity. I hopefully won't use the 2 minutes, but I did want to take the opportunity to highlight that the National Federation of the Blind, the most transformative organization of blind people in the country, is proud to make Maryland our home, and very pleased to be working with Secretary Beatty and her very competent staff to create a more accessible Maryland. Just wanted to talk about what that really means, especially in the context of the last question. I submitted written comments that talk about the collaboration that we are engaging in, but I think that I would be remiss, and maybe it was the Secretary's staff not wanting to be, wanting to be a little more humble. Maryland is making significant progress toward creating a more accessible space, not only just its websites, but also in the services that the state provides. It's an exemplary model that the Secretary reports directly to the governor. So there's an enculturation of accessibility throughout all the agencies. So all of the long list of engagement that MDOD is doing throughout the administration, throughout the different departments, again, is exemplary. And I think that it will have exponential impact over time. It is not reasonable to think that there will be one day that everything is truly totally accessible, although I, as a blind person, really do wish that day would happen. But as we make progressive steps toward making sure that the infrastructure that's in place facilitates accessibility, we as people with disabilities will be able to enjoy a more accessible Maryland, which gives us access to more of the programs and services. And also by creating that accessible infrastructure, it creates employment opportunities for people with disabilities within the government and without. And lastly, the return on investment is beyond just the benefit of people with disabilities. It's just proven that creating more accessible space, whether it be through services, programs, et cetera, just creates an ability for all citizens to benefit. Multimodal ways of accessing websites, services, equipment, not only just benefit people with disabilities, but also individuals who, as we say, are temporarily able-bodied. So that's the only thing I really wanted to highlight. But I really appreciate the fact that we're able to collaborate as a private nonprofit with the state of Maryland to create a more accessible Maryland and create an exemplary experience that we can really highlight and amplify throughout the country. Thank you.
Thank you. Appreciate that testimony. There's a question from Delegate Valentino Smith.
Please.
Thank you, Mr. Chairman. Not so much a question, but in light of Mr. Lewis's testimony, it's only proper then that I retract my frustration with the department for not, or at least appearing to me that we weren't making as much progress as possible, and congratulate them then for the view that the National Federation of the Blind has that all is working well. So thank you.
Thank you.
Changing opinions right on the spot. That's what testimony is all about. Are there any other questions for Mr. Lewis? Seeing none, thank you everyone for your testimony on that budget. We appreciate it. And now we're going to move on to the budget for MIMS, the Maryland Institute for Emergency Medical Services Systems. And with us today are the Executive Director, Dr. Theodore Delbridge, and the Chief Administrative Officer, Ms. Jeannie Abramson. So Dr. Delbridge, the floor is, I'm sorry, we're going to start with the budget analysis. Getting ahead of myself with Andrew Garrison. Andrew, please take it away.
Thank you, Mr. Chair. Good afternoon, members of the subcommittee. In front of you, you all should be seeing the MIMS budget. The change from a dollars standpoint is actually fairly easy to explain here. We're looking at that purple bar on your screen in the 23 allowance. What those are reimbursable funds. And there's one program in particular that's driving all those reimbursable funds. There's some funds that we're expecting to come in from the Department of Health for the C4, the Critical Care Coordination Center that MIMS has launched. And we're actually expecting some of those funds to be brought into 22 as well. So ultimately, we're really not going to be expecting much of a change in this budget. But I do want to show that that's really the difference that we're reflecting here thus far. Really quickly, MIMS, of course, has a large role in this and coordinating the state's EMS services. And so we do have a decent chunk of their budget that's actually related to telecom and IT expenditures. And then another large share, nearly half, is related to personnel expenditures. And then they're also involved in some work for reimbursable funds, as I mentioned, for assisting other state agencies, as well as the federal government provide some funds to MIMS's budget. And in particular, the largest of that is a coordination for the National Capital Region and emergency services there. Really quickly, MIMS has, of course, played a tremendous role in the state's coronavirus response. And one of the more recent changes that's happened with MIMS's budget, or with MIMS's operations rather, is a recent emergency declaration last month by the governor. And in coordination with that, MIMS was able to expand certain roles and responsibilities of EMS providers, including scope of practice, so allowing them to administer vaccinations to members of the public, which they were unable to do before, and also extending who can be practicing as an EMS provider to hopefully assist with some workforce shortages or to further provide services in response to the pandemic. Additionally, in order to try to bring more folks into the profession, MIMS is going to be rolling out an education stipend for EMT providers, and I've outlaid the payment schedule for that in Exhibit 3. Again, that's something that will be funded with some of those reimbursable funds we'd expect to be brought in. And DLS has a recommendation here, given some of these recent activities and initiatives to expand the EMS workforce. We have a recommendation for committee narrative on the implications of that and how those interventions have helped to increase the EMS workforce. Lastly, Exhibit 4, we touch on in this budget, we look at the emergency department wait times. This is for Maryland hospitals, and we're comparing Maryland's average wait time spent in the emergency department before leaving that visit. So not before they get admitted, but before leaving that visit. And we're comparing that to the national average as well as some of our neighbors. And as you can see, Maryland is relatively high. particularly when compared to the national average. Lastly, again, the only recommendation that DLS is making on this budget is that narrative around those workforce expansion efforts. But that does conclude my presentation, and I'd be happy to take any questions.
All right, thank you, Andrew. Any questions for Andrew? Seeing none, thank you. Now we will move on to the department. Dr. Delbridge and Ms. Abramson, please take it away.
Thank you very much. You caught me off guard there just a moment or so ago. Thank you for allowing me just a couple of moments. As you know, MEMS is responsible for overseeing or coordinating the statewide emergency medical services system, and we do that through promulgating clinical protocols and providing medical direction, licensing and certifying EMS clinicians, the EMTs and paramedics, supporting EMS educational programs, and licensing commercial ambulance services, as well as operating the statewide emergency medical services communication system. Thanks to Andrew Garrison for his comprehensive analysis with which we concur. And we'd also like to acknowledge Rebecca Bazzari, the DBM budget analyst assigned to MEMS. Much of what we've been focused on in the past year has been our ongoing efforts to respond to the COVID-19 pandemic, ensuring that the EMS system has the necessary resources to bring the greatest benefit to the community. Subsequent to the declaration of health emergency in March 2020 and the resulting executive orders that gave the EMS board and the MEMS executive director some latitude in efforts to augment the EMS workforce, we issued 9 public notices, and that work carried out through 2021. They included a path to create provisional EMS clinicians. These were people who were students who couldn't access the licensing testing at the end of their schoolwork. They were people who were expired and we recruited back into the workforce, and they were people who were licensed or certified in adjacent states who we expedited reciprocity for. In all, there were more than 1,200 of those people. We have subsequently created regulatory paths for them to achieve regular certification licensure. We changed the requirements for commercial ambulance drivers, those folks driving ambulances, transporting the least acute or needing patients. And we've been working closely with the Public Service Commission to ensure appropriate background checks of those people. And we created a path for paramedics and emergency medical technicians to be vaccinators. In all, EMTs and paramedics vaccinated over 80,000 people in the public for COVID-19, and more than 20,000 vaccinations were administered to government workers and public safety workers to ensure continuity of operations. Last year, the legislator passed a bill that provided for paramedics to administer vaccines to the public. That bill sunsets, or that legislation sunsets in January of 2023. And this year, House Bill 286 seeks to extend that sunset to 2026. We, as Andrew mentioned, we created the Critical Care Coordination Center to help match patients' needs to critical care needs with available resources throughout the state. That we are one of a handful of such programs in the United States and serve as a model for other states. As was noted, Maryland emergency departments continue to be stressed by overcrowding, and that often affects the emergency medical services system's ability to deliver patients to those places. To help alleviate some of that problem, we created a direct to triage protocol. 75% of the patients who go to a hospital emergency department get themselves there. It's inappropriate for a patient arriving by ambulance who isn't more acute than the patients who got themselves there to disrupt the queue for the hospital emergency department. And so we created guidance to help EMTs and paramedics recognize who those patients are, and without disrupting the queue, deliver them to the emergency department waiting room or triage nurse in the emergency department. We continue to develop the at-hospital ambulance dashboard. It's a tool that allows EMTs and paramedics to see, for example, on their cell phone or notebook computer, where ambulances are at hospitals in the state, so that they can try to avoid overloading a hospital that is already encumbered by a number of ambulances there, and have more informed discussions with their patients about where are the appropriate places to go. And we continue to work with CRISP, the Chesapeake Regional Information System, for our patients to develop a more real-time monitoring system of hospital emergency department busyness throughout the state of Maryland. We're in some validation phases for that. And finally, as Mr. Garrison noted, emergency medical technicians are really the backbone of our system. They represent the entry level of EMS clinicians and represent a pool for more advanced training. But oftentimes the rigors of training are an impediment to recruiting more. Oftentimes because of the time and other sacrifices people must make. So we are working with on a grant from the CDC, as Mr. Garrison pointed out, to help implement a pilot to incentivize more people to pursue training as an emergency medical technician and provide a modicum of financial recognition for their efforts. And with that, I'll stop and be happy to try to answer any questions.
Thank you. Are there any questions for Dr. Delbridge or the department? Delegate Valentino Smith.
I seem to be the question person. Sorry. Thank you. Smile. Thank you. So I just you've really given us a good brief, as fast as you can during a briefing of the role that EMS providers have played, pre-pandemic and especially during the pandemic, and our need to continue to make better use of them. And it seems that in some of our prior budget hearings, we had been taking information, I thought it was a pilot program or something that was being worked on where EMS providers were doing kind of some triage themselves in the field and or delivering people to alternative settings beyond the emergency room, and that some of the preliminary findings had showed there were actual savings to the system and assistance with emergency room wait times. And I'm wondering where that status of that evaluation or pilot is.
So there are a couple of efforts ongoing throughout the state, and you are correct. There was a report, I believe, in 2019 that MEMS authored with HSCRC, I believe, or the Healthcare Commission, that indicated that there were substantial savings to be gained by paying for reimbursing, if you will, the EMS system for care that's delivered without taking a patient to a hospital emergency department. Right now, the only way the EMS system generates any income from insurance or Medicare or Medicaid, whatever, is by actually transporting a patient. And oftentimes they can do quite a bit to alleviate the necessity to take a patient to a hospital emergency department at all, either with some proactive activity, and there are a number of jurisdictions in the state that do something called mobile integrated health, where they identify patients who are high users of the EMS system or recently discharged from the hospital, and they intervene before a call to 911 is ever made. And they do things like make sure that appropriate appointments have been made, that the patient has access to his or her medications, so they reconcile those medications, they make sure the home environment is safe and things like that. We believe those things have definite value to the healthcare system, period, in total. So there are those efforts. There are efforts going on in a couple of jurisdictions to transport patients to places other than hospital emergency departments where they're available. And a couple of counties have made inroads with urgent care centers and places of that sort, stabilization centers for psychiatric behavioral health patients or people with substance abuse or substance use disorder. And that those things are developing or evolving a little bit more slowly than we thought they might. The places that there are two parts. Those places don't necessarily want patients by ambulance, and patients, by the time they've committed to making a call to 911, oftentimes have a predisposition to wanting to go to an emergency department. That's where they think they're supposed to go. So we're working through those things.
So thank you. You can understand at least my frustration, maybe the subcommittee too, that in 2019, we got a report and we're the appropriations committee that talked about substantial savings that was agreed upon between the HSCRC and you, but I'm not seeing that translate beyond the 2019 report to practical savings. And I'm not sure where the shortfall is or what we need to do, but maybe we can work on that in the short time that we're in now in 2022, if you have any recommendations.
Sure. Well, and those savings were savings that were to be conveyed to the payers of the healthcare system, and those payers are slow to jump into the water. And
we're kind of familiar with them. Yeah.
And then our next opportunity to work with them is through the Maryland Hospital Association, who has convened a meeting of, we call them stakeholder innovate. I think it's the stakeholder innovation group. And it's been delayed by COVID-19, but the next one of those such meetings is later this month. And actually, we MEMS are on the agenda to discuss our ideas of how to expedite and propel us forward.
That's encouraging. Thank you.
You're welcome.
Encouraging. Thank you, Mr. Chairman.
Thank you. Any other questions? Okay, seeing none, we have no one signed up in addition to testify, so that concludes the budget hearing for MIMS. We are going to move on to the Department of Human Services Child Support Administration. We're going to start with, this time I'm going to get it right, we're going to start with the analyst, Grace Pedersen, and her presentation.
Thank you, Mr. Chair. It's my pleasure to present the Department of Human Services Child Support Administration Fiscal 2023 Budget Analysis. Going to the first exhibit, the budget remains relatively level. There's a increase of less than $2 million. And what's notable here is that special fund expenditures increase, and it's mostly due to child support reinvestment funds, which revenue to that special fund is actually federal incentive payment dollars from that the Federal Office of Child Support Enforcement provides to the state for its performance in a fiscal year relative to other states' performance. Those special funds are being used to offset some general fund need, and federal funds decrease slightly because they're matching general funds. These special funded expenditures are not matched by further federal funds. Looking to the first exhibit, half the budget is for personnel, and then the next largest chunk is for cooperative reimbursement agreements. These CRAs are with local governments to carry out certain child support functions, and then the Baltimore City privatization contract makes up the next largest portion of the budget. Going to the fluctuations from fiscal 22 to 23, there's some variations in personnel expenditures, but the most substantial change is for the cooperative reimbursement agreements with local governments, followed by an increase for the Central Disbursement Unit, which manages the receipt of child support collections and then the redistribution of those child support payments to families throughout the state. Looking at personnel, the department's vacancies within this administration are double the budgeted turnover rate, and there are 29 positions that have been vacant for over a year, and personnel will be further discussed in the administration analysis that you'll hear in a couple of weeks. Looking to the issues, the first issue is about child support and performance. And as I mentioned earlier, the state receives federal incentive payments for its performance relative to other states against 5 measures. And those measures are paternity establishment, support order establishment, collections on current support, cases paying toward arrears, and cost effectiveness. So I'll go through the state's performance against these measures in this issue. Looking at Exhibit 3, the state exceeded the goal in the proportion of cases paying toward arrears. It slightly missed the goal with cases with support orders and current support collections, and it missed it by a little more for paternity establishment, but DHS attributes this to the father's lack of access to hospitals during this year. Then going to Exhibit 4, this interim in response to the Joint Chairman's report, the department submitted data about each jurisdiction's performance against these measures that determine the state's federal incentive payment. So what's interesting here is that basically how difficult it was for jurisdictions to meet each goal. And the most difficult goal to attain was current support collections, and then 19 jurisdictions were able to meet the goal for cases paying toward arrears. And then the last goal that I haven't talked about yet is cost effectiveness. And what's interesting here is that basically Maryland has historically been had cost effectiveness that was under the national average, but the differential grew starting in federal fiscal 2019, and it continued to grow during pandemic months. So national data for federal fiscal 21 is not available yet, but the state's cost effectiveness continues to decline in that year. In its testimony last session, the department indicated that the declining cost effectiveness was due to collections not increasing at the same rate as the expenditures associated with child support administration. And one of the causes of this was the development associated with the MD Think shared platform. So now that the IT project is expected to conclude at the end of fiscal 22, DLS recommends the agency comment on how it expects that to impact cost effectiveness. And like the other measures, there was also data available about cost effectiveness for each county. And there is a differential between the counties. So DLS is asking the agency to comment on that and whether there are regional factors that are affecting cost effectiveness and how it attempts to holistically improve cost effectiveness throughout the state. So that concludes that issue. Going to the next one, starting with Exhibit 7, this issue discusses collections. And collections on child support saw some interesting variations during the pandemic, and this is representing the intersection of available enforcement actions and then the kind of policy changes that arose during the pandemic. So as you can see, collections on arrearages grew in both Maryland and nationwide in federal fiscal 2020. And that was primarily due to the stimulus payments being able to be intercepted for child support arrearages. The second and third stimulus payments were not able to be intercepted. So you see collections return to kind of pre-pandemic levels in federal fiscal 21. And Exhibit 9 starts the third issue, and this is pertaining to child support enforcement activities. So during the interim, the department submitted a report on all the different enforcement activities that it utilizes, whether it's required by the state, the federal government, or both, and the frequency of utilization of each of those enforcement actions. The department also submitted data about the collections for each case that had an enforcement action. And the only data that was available was data for automated enforcement actions that were applied by the legacy child support system. But the new child support system is expected to complete development at the end of the current fiscal year. So DLS is recommending to request this data again, but including the manual enforcement action to see whether there is variation in the percent of cases that receive collections when an enforcement action is applied. Looking here in Exhibit 10 and only the manually applied enforcement actions, it's notable that all these different actions see collections for virtually all cases except for driver's license suspensions, with which even when that enforcement action was applied, over 20% of cases still did not receive collections. In this same report, the department identified policies that other states use that are not implemented in Maryland. The first of which is reporting on independent contractors. So 12 states require that independent contractors be reported to the state's child support agency. And this allows those individuals and the earnings they receive to be matched against the list of individuals with support orders. But as Maryland does not have a mechanism in place to require that the earnings that independent contractors make are not easily reachable by typical enforcement actions. In the 2020 session, the department submitted an administration bill to change to allow earnings from independent contractors to be reported on an IRS form, but that bill did not pass in that session. Since then, the bill has not been resubmitted either in the 2021 or the 2022 sessions. The second policy that other states implement is participation in the child support lien network. So 28 states, including each state that borders Maryland, participates in this network. Basically, participating states work with insurance companies. So when an individual makes a claim, it could be run against the list of individuals with support orders. And if they have past due support, the claim payment could be garnished for child support for arrearages. And that's all I have to say for the third issue. And then here's the two recommendations. The first one is requesting that data on the state enforcement measures and associated collections. And then the second one is continuing to request data about child support performance. And that concludes my presentation. I'd be happy to take any questions.
Sounds good. Thank you, Grace. Any questions about the analysis? Okay, seeing none, we're going to move to the department. With us today is Secretary Lourdes Padilla, Deputy Secretary Netzanet Kibret, Executive Director of the Child Support Administration, Kevin Geistwhite, and the Chief Financial Officer, Stafford DePongo. Madam Secretary, the floor is yours. Please take it away if you are with us. Oh, there you are. There's the whole gang in one picture. There we go.
Yes. Thank you, Chairman Resnick and members of the committee for the opportunity to discuss the fiscal year 2023 budget allowance for the Department of Human Services Child Support Administration. And thank you for introducing my team. I want to thank Grace Patterson for the comprehensive and concise analysis. She's a pleasure to work with, and we appreciate all her support. You have my written testimony, which I won't repeat here. Before I address the 2 recommended actions and 5 issues in the analysis, I want to highlight some of our accomplishments. The department collected and distributed $543 million in child support last fiscal year. Of that, $160 million was distributed to families previously receiving temporary cash assistance, TCA, reducing the likelihood that those families will become dependent on the state for financial stability. As of the first quarter of federal fiscal year 2022, $124 million of child support have been collected and distributed. Between federal fiscal year 2019 and 2021, the amount collected per case increased 8%, rising from $2,975 to $3,218 per case. This $243 increase was achieved despite the total number of child support cases decreasing by 8% during that same 3-year period. Effectively, we collected more from less. Since 2015, the department has disbursed $4.9 million in gaming intercepts from video lottery winnings to pay past due child support, as authorized by HB 907 in 2014. Finally, we believe the role of the Child Support Administration is more than just enforcement and collections. Our goal is to help and support non-custodial parents in their efforts to secure gainful employment so they can meet their obligations. To that end, the Step Up program continues to be a success. This program and others like it provides eligible, unemployed, or underemployed non-custodial parents with assistance in obtaining employment that would enable them to achieve economic self-sufficiency and to meet their child support obligations. That concludes my opening remarks. Now, with your permission, I will move directly to the recommended actions and issues in the analysis. The DLS analysis contains 2 recommended actions. The department concurs with both recommendations. Turning now from the recommended action to the 5 issues for discussion. In response to issue 1, regarding the department providing periodic reports on 5 child support performance measures, the department concurs with the analyst recommendations. In response to issue 2, regarding the anticipated impact on cost effectiveness with the deployment of the child support system, the department does anticipate increased cost effectiveness when the new cloud-based child support management system is fully deployed and the legacy system is decommissioned. In response to issue 3, regarding regional factors which might impact cost effectiveness, the department believes there are regional factors that may impact cost effectiveness, including economic and community trends and employment opportunities available for non-custodial parents, which can increase or decrease collections. The department does monitor agency costs for child support to ensure they're reasonable and necessary to support the program activities. To promote best practices across the state and increase the timely receipt of collection, the Child Support Administration provides local guidance for managing cases to address the family needs in a holistic manner. follows federal protocols to open and close cases, and uses customer outreach and enforcement revenues as appropriate. In response to issue 4, regarding the departments providing updated data on collections among both automated and manual actions, the department concurs with the analyst recommendation. In response to issue 5, regarding the DHS plan for participating in the Child Support Lien Network, or CSLN, the department is interested in participating in the lien network, or similar services is available, and the department supports the passage of state legislation that would authorize our participation. This concludes my testimony and response, and I will be happy to address any questions the committee may have. Thank you.
Thank you. Let's move to Delegate Henson.
Thank you, Mr. Chair, and thank you, Secretary Padilla, for responding to each of the bullet points with particularity. I wanted to visit the report that you all submitted during the interim that gave us the comparison state by state of child support enforcement activities, and then also a comparison to the federal mandates that exist to tap into the incentive payments. The first takeaway that I had from that was just looking at the sheer number of cases, the caseload state by state. Maryland was somewhere in the middle of the pack in terms of the state population, but when it came to the overall caseload, Maryland was at the bottom of the pack with the number of cases being administered by our department. Do you have any insight on our caseloads as it compares to other states of similar size?
Thank you very much. Question, and I'm going to ask my Executive Director for Child Support Administration to elaborate on your response. Okay?
Thank you, Secretary. Thank you, Delegate Henson. The caseload that Maryland has is similar to other cases in terms of what we looked at from the peer group that the federal government looks at comparing our different states. What we have been seeing is there's trends in cases dropping nationwide, which is also what we're seeing in Maryland right now. And that's what we were able to see so far in that comparison that we had with other states that were in our peer group.
Thank you, Mr. Geiswife. If the chair will permit me another question. I'm very interested as well in our looking at cost effectiveness, how the Baltimore City private contract factors into that. It looks like it consistently underperforms in terms of collection rates and all those different factors that we're looking at to define success. And I even saw that this year we held back some incentive payments from them that seemed totally appropriate based on the numbers that were reported out of the contract. What is the thinking with continuing with the private contract when it looks like we're not getting any better results?
Thank you. Very good question. We continue to monitor the Baltimore City performance and the contract. And I know that my executive director has been in close communication with the leaders of the company that we're using. And I'm going to ask him to elaborate on what those conversations have been and whether he perceives that there has been any additional improvement or not.
Thank you again, Secretary. And Baltimore City has a different set of performance measures based upon the history of the contract prior to this current vendor that has the privatization contract, where they stood in terms of where the performance was when the transition occurred. The remedy or the performance measures had to be set a little bit lower as they worked toward increasing that. And what we've seen over the last 5 years of this contract with current vendor is improvement in the Baltimore City performance, in which they have met 3 out of the 4 goals that were set for them. And as you mentioned, the one goal was in current collections, which they did not pass this time, and they did have the penalties that applied. But overall, we feel happy with where they're headed and how they are helping to bring up the performance across the state, actually. But there is more work to be done as we continue to monitor them and see where that goes forward with the upcoming RFP for privatization.
Thank you. I know that it's something this subcommittee will be monitoring closely because we want to make sure that the getting as quality representation of support enforcement, notwithstanding having. If I could be permitted just one final area, I did want to ask about the driver's license suspension. When we looked at the data provided by Ms. Pedersen, it looked like of all of the different enforcement tools that the driver's license suspension had the least effectiveness of each of those that was highlighted. I know that I have a bill this session that would prohibit license suspensions for child support obligors that are making 300% of the federal poverty limit or less. I would like to know, based on the new software that you have, what the agency's readiness is to implement a policy like that.
Thank you. The new system would be implemented by this budget by 2022, and we will have the capability of tracking more in an automated way. But I'm going to have my executive director expand on the driver suspension program.
Thank you again, Secretary. So in terms of where we are with the new system, we will have more functionality and capabilities of doing things like what you are presenting. The challenges we still have is in.
I hate to interrupt. I'm having trouble hearing you.
I'll try again. So what we're doing with the driver's with your bill that you propose is we are, with our new system, going to have more capability to be able to do things like what you're proposing. The challenges that we still have, though, with that area would be having the information in our system. We have many different types of orders that are done outside by the courts or through private agreements that are not currently captured, so we would not know the income levels to be able to fully know that automated. So we may have to require some additional work from non-custodial parents to provide information to us in order to ensure that we know if they would be excluded from driver's license suspension. And to your comment about the performance of the driver's license suspension, it's the one area that we had control over during the pandemic, in which we actually forgave and did not suspend a lot of licenses. So in 2021, it would show less collections for that. It's also one that is used against a lot more different cases early on in the child support process, whereas the other automated functions are higher arrears thresholds, which get more collections, higher collections in, which is one of the reasons why those numbers look that way in the report.
Thank you, and thank you, Mr. Chair.
Thank you. Delegate Valentino Smith.
Thank you, Mr. Chairman. It's a vulnerable population. So I might have 3 different areas. I'll try and make them brief. And just following up on the good delegate from Anne Arundel County, who was bringing up the fact that there's a lot of geographical disparity. On page the report, from a parochial perspective, I see that you list my county as not meeting 4 of the performance goals and some of the other counties. Are you doing anything specific to help these counties other than note that they're not meeting their performance goals? In other words, is there any active interventions here to be increasing what has already been reported to us in evaluation of, not good performance and lack of meeting performance goals?
Thank you, Delegate.
Besides the periodic reporting to us that they're not doing well.
I know, right? No, thank you so much. Very good question. We do provide very close support to the counties that are not doing well, including assessment and what tools they would need to increase performance. But in addition to what I said, I'm going to ask my executive director, who meets very frequently with the 24 jurisdictions, what other kind of support and what else is being done for them to be able to meet or improve their performance.
Thank you for your question, Delegate. We do meet regularly with all of the directors across the state of Maryland. Additionally, in the largest jurisdiction, metros, we meet very frequently with them because they do report directly to the Child Support Administration. And we do monitor performance. One thing with our new system coming out, we're going to have new reports and dashboards to help monitor their performance at each of their local levels. And we're also consistently looking at ways to gather how we perform. So we have a performance group that consists of the local directors, as well as some of our agency partners who help us to look for trends and give guidance on where they can do to improve performance. And of course, in this report that you're seeing too in 2021, it was fairly impacted by the pandemic, where you're seeing a lot lower numbers for some of the jurisdictions that perform usually higher, because we did challenges with court closures and some other aspects in terms of collecting support, collecting arrears, as well as in establishing orders timely or even modifying CTs who may have lost employment during the pandemic.
Thank you. It sounds like then in our JSON language or in the recommendation on you continuing to put periodic reports, we just need to be specific on asking what you're doing in each of the jurisdictions and what the jurisdictions' shortcomings are. Mr. Chairman, if I may, can I proceed to another area?
Yes, please.
Thank you. So very specifically, Secretary, and it was a little hard to hear, so I misheard, but on page 17 of the report, when you're responding to the state participation in the CSLM program, you said, I think that you thought that it was a good idea and that you were anxiously awaiting the passage of state legislation to do it. If I heard that correctly, is there a bill? Did you make it an administration bill? I may not have seen it yet, but what are you doing with respect to being able to move forward with that?
Thank you. Very good question. No, there is not a departmental bill this year. Next year, that is under consideration to propose legislation. As the analyst stated, this was a bill that we proposed a couple of years ago, and it did not pass. The department since then embraced in other initiatives that my executive director here would elaborate on. And at that point, we more appropriate to focus on the initiatives that we've been working on, and then be better positioned for when we introduce this bill to be more successful. If you would elaborate on what I just
The Secretary is referring to, we had a departmental bill in 2019 to have this put in place, but did not pass. And the reason why we came back in 2019 was we wanted to get the system requirements in place for our new system that's in development, so we can include that in the rollout. Now we're currently in the last 2 years heavily involved in finalizing the development and now in the rollout of that system, and that we can't add new things right now because it's also very complex with federal regulations and they have to certify the system. And during the time following the rollout of our system and their certification approval, we can't make major changes to the system at that time. And so once we are able to get that bill approved, which we plan to come back for, we will be able to add that into the system then at that point.
So it's your position, even though it's a public-private partnership, that you can't proceed without a statutory change?
That's correct. We need to have a bill to allow us to do this.
Okay, thank you. And just a final question, Mr. Chairman. In terms of the intercepts, very important. It's a very vulnerable population. One of the reports in the appendix is telling us that 50% of the cases on temporary cash assistance have an order for child support. So this is a vulnerable population that really needs to try to get what they can to support these needy children. So are you making any recommendations or thinking about, with the onset of gambling, online gambling, that there be intercepts for that going forward? I know that there's some lottery, but are you starting to make some significant analysis and recommendations on online gambling and whether or not the administration believes it would be important to have intercepts on that?
Thank you, Delegate. We are constantly monitoring recommendations that we would like to make to improve the collections and the intercepts on all sorts of income. Specifically to online gambling, I have my executive director elaborate on what has been done in the past and what are the discussions that are we're taking right now to see if this is something that is something that we should be looking into, or have we had experiences in the past where it's not, perhaps the timing is perhaps not the best.
Yeah, so it is another enforcement area we're looking at, wanting to enhance upon. If it's something that we're able to do, it likely would require another bill to give us the authority. I believe I have to look at that to see if it's something we would need. Once again, like I said before, with our new system rolling out, now that once we roll it out, we'll be able to actually make kind of changes. So if we do need a bill, we'll be coming forward with a bill to get something like that in place. As always, to try to enhance collections to help with our performance.
Thank you, Mr. Chairman. I guess we'll proceed with wisdom acquired late is nevertheless wisdom, so that maybe next year they'll intercept. Thank you for your patience, Mr. Chairman.
Thank you. Next year is going to be a very, very different year. All right, with that, any other final questions for the department? Seeing none, we do have testimony. Let me make sure I get everyone because it's a long list here. All right, we have oral testimony from Jean Rose and Denise Gilmore of AFSCME in the unfavorable. So Ms. Rose, Ms. Gilmore, please. Let's start with Ms. Rose and then Ms. Gilmore.
Chair Resnick, Ms. Rose actually had to take off for a medical appointment, unfortunately. So we just missed her.
Then you have the ball.
All right. Well, thank you very much. Well, good afternoon, everyone. For the record, my name is Denise Gilmore, and I'm a field director with AFSCME Council 3. Within the Department of Human Services, we represent around 4,200 employees, including those who work for the Child Support Administration. We would like to note that we continue to be very concerned about the staffing situation in child support and across DHS and almost every state agency. Years of unnecessary hiring freezes and a failure to keep state employee salaries competitive have caused this kind of perfect storm that we're in right now, where we have these record number of vacant positions across the state. But of course, these issues do predate the pandemic. We're very glad that the budget does include, finally some long overdue raises, but we are in an awfully big hole. As you just heard from the analysis, child support has almost 50 more positions vacant than they should. DHS has over 800 vacant positions, and statewide there are over 6,000 positions. These vacancies mean that we're struggling to maintain the current caseload that's in, child support. Our members have reported backlogs at Anne Arundel County and Prince George's County and Montgomery County, for instance. We do think more can and must be done. We're concerned that the only proposal the DHS administration has offered so far is lowering the experience and education requirements for some positions. We do not think this is the right way to go. We think they should instead be investing in retaining and recruiting these experienced professionals. As I mentioned, we had a member who was planning on testifying today. She did want me to highlight two things in her absence. The first is that, she's a child support specialist who's worked for the state for 10 years. All child support specialists start as trainees. That starts at $32,000 a year. The salary was just recently brought up to $15 an hour. After 6 to 12 months, you are upgraded to a specialist one position. That's at $34,000 a year. That's only a little over $15 an hour. The reason that she certainly believes that this, DHS is having such a hard time hiring workers is because the salaries are just too low. Where she works in a more rural county, for instance, the Wawa pays more there, as she reports. In the federal government, they are losing quite a few employees to the federal government too, as we're seeing federal jobs increase in hiring. And then finally, her last point was, she also feels that, the state is particularly having a hard time retaining younger workers. And it would make sense to look at maybe lowering that vesting age back down to 5 instead of where it is currently at 10 years. That concludes my testimony. I'm happy to certainly take any questions, but we really appreciate the opportunity to testify today.
Thank you for your testimony. Thank you for being here. We have a question from Delegate Henson.
Thank you, Mr. Chair. Thank you, Ms. Gilmore, for the testimony. The cost effectiveness is one of the metrics that we look at to measure performance here. It sounds like what you're advocating for is increases in salary. Can you help us understand, based on your conversations with our child support workers, how increased salary might affect the agency's effectiveness?
Sure. So, and this was actually, I think, a really good point in the analysis that I didn't have time to bring up, but child support is one of the most cost-effective programs that the state offers, right? And that, every dollar that we get into, kids, gets spent back in our local economy somehow, right? So the idea is, as we are able to, produce and enforce these orders and pump more money into supporting these children, that money goes right back into our economies. And the problem with having these high amounts of vacancies is that, we're not able to do the enforcement how we would like. And, we're missing out on opportunities to really get that money pumped back in. And so it's kind of a self-fulfilling prophecy. The reason that, folks leave is because they can go make money elsewhere or make more money elsewhere. So that creates a vacant position. Well, then you have a hard time recruiting for that position because the salaries aren't enough. So, we certainly think that you could both increase salaries and, get a higher output in terms of what the department can produce if we're able to fill those positions. I think that's where it starts. But when we have cases that are, on a backlog that still, haven't been attended to from, over 12 months ago, then, it's hard to, it's obviously hard to get that money back out. So we do think it's a good investment to, invest. And I would just add that obviously when you're paying, a raise to one of our members as well, our members generally aren't, going on like fancy vacations in another country, right? Like they're spending money right here in our local economies too. So we absolutely think, it's the best call for our local economies to increase wages and really fill these positions so that we can, fully utilize the mission of the agency.
Thank you, Ms. Gilmore. Thank you, Mr. Chair.
Thank you. Any additional questions? All right, seeing none, that concludes the budget hearing for the Child Support Administration. We are now going to move to the Maryland Department of Health's professional boards and commissions and the budget analysis from Morgan Smith. Go ahead, Morgan.
Thank you, Mr. Chair. Let me share my screen. It's my pleasure to present the operating budget analysis for the health professional boards and commissions to you today. First, I want to note the fiscal 23 budget increases by $5.1 million to a total of $50.9 million. And that's an increase of 11.2%. And you'll notice that most of that increase is in special funds. And that's primarily because the agency works administratively and uses that money for contractual services as well. In the overview, you'll see that regular employees and contractual FTEs account for about 70% of the total agency spending, with the next biggest chunk being contract expenditures at 24%. And the majority of that can be attributed to the Medical Cannabis Commission. I'm also going to briefly walk through the proposed budget. So you'll see that most of this growth is, I believe, $3.5 million of this growth can be contributed right to the Medical Marijuana Commission. And most of that goes to contracts. Let me show that so it's on your screen. Additional contracts, 1.9 million of that is going to a database audit system, several ways to analyze cannabis health and safety, and the licensure database that they're using. And you'll see here on the right that most of this growth is for very simple things like furniture and lab equipment and ID printers, and in addition to contractual FTE payroll expenses. And that is primarily because most of the increase in contractual FTEs for the boards and commissions go right to the Medical Marijuana Commission. 8 of the 10.1 contractual FTE increase for fiscal 23 go to the commission, and they're for administrative purposes, primarily processing licenses and other things like that. There are 2 other contractual FTE positions in the boards, one for the Board of Dental Examiners and the other for the Board of Physicians. And the health boards also saw an increase of 3 positions. This is actually a net increase. There were 2 positions that were transferred out of MDH and from the boards, and 5 positions transferred in. 1 of those positions went to the Board of Physicians, 3 went to the Board of Nursing, and 1 went to a various other board. And now, for the meat and potatoes, I want to just briefly touch on a couple graphs here. Exhibit 3 is showing you the boards, the total number of boards who are missing licensing renewal or investigation goals between fiscal 2017 and fiscal 2021. So each of the boards has MFR goals that they're supposed to meet, and there's a certain percentage. And this varies slightly for the Board of Nursing and the Board of Physicians, primarily because they're bigger boards. But you can see here that in 2019, there was a peak of missing investigation goals at 14 out of 21 boards. And then they've been doing better. In 2021, we had that down to 10. And just to note that the Maryland Medical Cannabis Commission is excluded from this graph and the next graph that I'm going to talk about, just because they've got differing methods of measurement going on right now that don't align with the other boards. Exhibit 4, I need to do a little clarifying of this graph. So this is presenting aggregate data for all of the boards from 2017 to 2021. And so if you got an X, that meant that you met your goal, your percentage goal every year for the last 5 years. So if a board is missing, let's say acupuncture is missing the MET investigation goal, that could be because they've only missed 1 year, but that was below the threshold of meeting all 5 to get the X. So for the most part, all of our boards have met or are very close to meeting these goals. The one that is not included in this is the Board of Dental Examiners. And this is something that is a little concerning. They haven't met their goal for the last 5 years. And in 2021 specifically, they had only investigated, completed the investigations for 37% of all investigation complaints. And then they were within 13% or 7% for the new and renewals of licenses. So that's pretty far below what we would like to see. And because of that, DLS recommends adopting committee narrative that would ask the Department of Health and the Board of Dental Examiners to comment on how they plan to remedy this lack of being able to meet their MFR goals. I would also like to touch briefly on the cybersecurity incident. So it is my understanding that due to the cybersecurity incident, the Board of Nursing and other boards had moved to paper applications. And in a Health and Government Operations hearing, I believe on January 13th, it was reported that the Board of Nursing had volunteers coming into different places across the state to help process these paper applications. It is our concern that moving forward, as they move back to being electronic, there will be a backlog and still individuals will need to help process these paper applications. And so DLS recommends adopting committee narrative, requesting that the Department of Health touch on the details that impacted the cybersecurity incident on the boards, how the boards plan to meet their licensing, renewal, and investigation goals moving forward, and how we plan to help in their recovery post cybersecurity incident. And then just one more graph. This is Exhibit 5. This is the outlays for their the Department of Health's licensing and regulatory management system project. So this project is actually housed in the administration budget, but we chose to talk about it here because it directly impacts the boards. And what you're seeing here is the amount of money that was listed in each of the budget books from 2021 through 2023. and what the goal amount of money per year was listed and what the total cost was listed as for each of these budget books. So I really want to point out here that in the most recent budget book, the total cost for this project increased to $10 million. And previously it had stayed in the realm of $2 million. I believe between like 2.1 and 2.5 or something to that effect, but less than $3 million was the total cost. So this is something that we are concerned about. We don't have a lot of information on it. So the Department of Legislative Services has requested committee narrative from adopting committee narrative to have the Department of Health submit a joint report with DoIT to break down these costs and explain why it is now increased to a total of $10 million for the entire cost of this project. And I just want to go through some of my recommendations. So I'm not going to go through all of them because I've already touched on 3 of them briefly, but there are 3 that are they're in connection to repeat audit findings, which are in the appendix. So I'll go through those very fast, and then I will show you the audit findings so you can see it on your screen. Our first recommendation should be on your screen, and that is to adopt language to restrict $100,000 from both the Board of Professional Counselors and Therapists and the Board of Pharmacists to have them submit a report that outlines how they plan to remedy the findings. Both of these boards only had 1 finding each, and I'll show you that in a second. And then recommendation 3, so this is just adopting narrative. Finding 3 of the audit showed that 19 of the 21 boards did not have adequate controls over their collections and deposits. And so we've asked that the entirety of the health professional boards and commissions submit a report that addresses and resolves audit findings and to identify steps moving forward that they would like to take to resolve the repeat audit finding. And last, recommendation 3, this is for the Board of Nursing, and we would like to adopt language that restricts $100,000 from the Board of Nursing because they did have 2 repeat findings. And we would, again, like them to address these findings, talk about what they're going to do moving forward, and just give us both steps and what they've already done so far to resolve these audit findings. So sorry for the scrolling. So this is the audit finding. So you'll notice that there are 4 findings that are bolded. Finding 2 pertains only to the Office of Healthcare Quality. So that was under another analysis, but findings 1, 3, and 5 are the ones that I was just referencing. And you'll notice that the Board of Nursing has a repeat finding in both finding 1 and 5. And then finding 3 is the joint finding for 19 of the boards. So that's kind of where we're at now. And there's also data, there's an additional appendix on the IT project if you want to look at that as well. But in the meantime, I'm willing to answer any questions that you might have.
Thank you. Thank you for that analysis. Are there any questions for the analyst? Okay, seeing none. Thank you, Morgan. Appreciate it. We're going to go to the department. We'll start with Secretary Dennis Schrader, Chief Financial Officer Emily Brandenburg, the Boards and Commission Liaison, Ms. Kim Link, the Budget Director for MDH, Mr. Nick Napolitano, and then the Assistant Secretary for Policy, Mr. Webster Yee. Mr. Secretary, take it away.
Mr. Chairman, thank you. I'd also want to note that, and by the way, it's Secretary Dennis Schrader for the record. We also have a representative from the Board of Nursing, the Board of Physicians, and the Board of psychology examiners who are here to answer questions of the committee. I'm going to start out by just thanking the committee for having us here today. This is a very important group of health occupation boards to the department, and Assistant Secretary Yee has responses to the 3 questions from the analyst, and we thank the analyst for her work, which was very thorough. So I'm going to turn it over to Mr. Yee to give our responses to the 3 questions, and then we'll be available to take questions from the committee.
Thank you, Mr. Chairman. Good afternoon, members of the subcommittee. Webster Yee, Assistant Secretary, Maryland Department of Health. We have submitted written testimony to the subcommittee for its detailed reading pleasure. With respect to the analysis, we again thank Ms. Smith for her insightful analysis. With respect to the committee narrative regarding the Board of Dental Examiners, the department concurs with the recommendation, and we look forward to working with all of the health occupation boards on the various audit findings to see how the department can help and improve to eliminate any potential repeat audit findings. With respect to the DOS recommendation about committee narrative regarding the cybersecurity incident, the department respectfully disagrees with this recommendation. We've been providing weekly network incident updates via letter sent to the General Assembly and other stakeholders, and also available on our website. I believe all of the members' offices received our latest update from Friday evening. Regarding the Board of Nursing specifically, and it's mentioned in the analysis, as of January 27th, the board can process renewal applications, submitted online applications, and they've been working through the applications in order that they've received. As of a few days ago, the Board of Nursing has processed 9,400 backlogged online applications. A relative small minority of these applications are pending for other reasons, approximately 6% of them. So as of a few days ago, we're at about 8,774 applicants have fully completed applications that were processed by the Board of Nursing. The only pending licenses at this time are a few paper applications, licenses which require a background check, and licenses which still require verification of education requirements. The Maryland Department of Health and the Board of Nursing have been working collaboratively together to identify staffing needs, and we've been helping the Board of Nursing so that they can go through their backlog as quickly as possible. There is a letter detailing the Department of Health's assistance to the Board of Nursing attached in your packet, and the board has posted a public notice to all nursing license holders of their next steps on their website. It's a reference in our website in our narrative. Lastly, with respect to the Do It narrative, we respectfully disagree with this recommendation. The information has been provided. Please see the governor's budget highlights for fiscal year 2023, Appendix N, page N32, and it's also submitted in your packet. As the analyst detailed, there's about $10 million to this total initiative. We believe, and we have offered in conjunction with the Department of Information Technology, that all of the health occupation boards will choose to adopt the Do It one-stop licensing platform, which we are currently focused on planning and developing primarily for Board of Nursing, but we hope to make it available to the other boards at the state's cost using general funds. In addition, we would note that the one-stop licensing portal has been of material benefit during the network security incident. The Maryland Medical Cannabis Commission, which is the only health occupation board and commission on one-stop, experienced no disruptions because of the incident. And with that, thank you for your indulgence, and we'll turn it over back to Secretary for questions.
Mr. Chairman, we're available to answer any questions of the committee.
Wonderful, thank you. Are there any questions? All right, seeing none, I have a few, if you don't mind.
Yes, sir.
Um,
No, please.
So I have two main questions. One deals with staffing. In speaking to a number of the boards, they have money in their budgets, and obviously they are run entirely by special funds through their own fees. But yet they cannot authorize additional PINs without the department and the Department of Budget and Management approving them. I was wondering what the status is of the approvals for those PINs in order to be able to help the departments do the work that they are so behind on.
Yeah, so, Mr. Chairman, I can give you an initial response and then maybe get further update from Ms. Link and Ms. Brandenburg. At the moment, what we do is we do a review of all PINs in the department overall every 6 months. We have a committee of the CFO and the HR director and the chief of staff, and we go through all the PINs where people have needs for PINs and where people are not hiring. One of the challenges for the health occupation boards is they have 42 empty PINs right now, and we have transferred 5 PINs in the fall to, as you saw in the analyst report. But our focus is on getting the vacancies filled before we would add additional PINs.
Okay, and then my second question deals with the IT system with One Stop. To what extent are you working with the other boards other than obviously the Cannabis Commission on their needs with regard to One Stop? It's my understanding in discussing with some of the boards, they have recently adopted different IT solutions to their licensing needs and feel that those solutions are better for their purposes. So in some cases, this is just my surmising, it feels like the department is sort of shoehorning One Stop to meet the needs of everyone versus, building a collaborative tool that everyone can use and can function well. So to what extent are you working with the boards to sort of figure out what their needs are and figuring out whether One Stop or some other solution might be appropriate for everybody?
So, Mr. Chairman, thank you for that. There is a report that has just been submitted to the Education, Health, and Environmental Affairs Committee and the Health and Government Operations Committee on January 12th by DoIT, which did a commission by commission review or board by board review of what it would take to meet their needs. We believe that many of the functions that the boards have are very common in terms of licensing. And we also know that many of the boards and commissions at Dollar are starting to move towards the One Stop portal. What we have offered is to pay the operating cost and the cost of building the solution for the boards if that's what they want. Now, they are independent. We have no authority over them, so they can make whatever decision they want. But what we're trying to do, there's a bill that's going to be submitted, I think by Senator Kagan, Senate Bill 899, which would offer that the health department, through general funds, would pay for the operational infrastructure of the boards, and therefore they could use their money for the licensing process, but all the infrastructure costs would be paid for by the health department. So we believe that is a very effective way to go, and we're working very closely with DoIT on supporting the boards in that way.
Okay, well, we will keep watching that situation. Hopefully we will find a amicable solution for everyone. Are there any other questions? All right, seeing none, thank you to the department. We will move to public testimony. Let me bring up that list. I believe, and Secretary Schrader, if you can confirm for me, the folks who are listed as signed up to testify from the various boards, they're just there for questions. They're not doing their own independent testimony.
That's my understanding, Mr. Chairman. They're here to answer questions that may come up.
Okay. Why don't we, okay. We will go then to Robin Elliott from the Maryland Nurses Association.
Good
Robin,
afternoon, Mr. Chairman.
2 minutes.
2 minutes. Good afternoon, Mr. Chairman, members of the committee. I am here on behalf of the Maryland Nurses Association, but as many of you know, our firm also works with social workers, occupational therapists, and professional counselors, and we do an awful lot of healthcare work. I am just here today in support of the board's mission. They are, when we think of frontline public health, the boards. They're the ones who make sure that our healthcare practitioners, the ones who are in direct contact with patients all over the state, they make sure that they have the appropriate experience, training, and education. I know you all have discussed sort of the needs of the boards, would very much support any effort to ensure that they get both the positions that they need and that they are able to fill them at the level that they need, making sure they have highly qualified people because they are certainly faced with many challenges. I know that you here have many kind of other frustrations, of course, amplified by the recent ransomware issues. I just wanted to flag that I heard from 2 of my clients that had incredibly positive experiences. The Board of Nursing and the Board of Dental Examiners really went out of their way to expedite licensure for some providers who were needed very much to serve in extremely underserved rural areas. So I wanted just to let you know about some very positive feedback about boards and committed to working with you all, the department, and any others to really support the mission. Thank you.
Thank you. Any questions for Ms. Elliott? All right, seeing none. One last take. Does Ms. Evans, Ms. Scott, Mr. Hicks, Mr. Raymond, Ms. Smith, or Ms. Taylor have any additional comments?
Yes, this is Karen Evans. I do.
Okay, sure. Go ahead.
Thank you so much for giving me this opportunity. Along with the individuals you mentioned, our board president is here, Mr. Hicks, and our deputy director, Rhonda Scott, and our board secretary, Dr. Greg Raymond. I just wanted to comment on a few things. The first is, I'm not sure where the analysts received the information concerning volunteers. We do not have any volunteers, have not used any volunteers during the cyber incident. So I'm not quite sure where that information came from. As Ms. Siggy said, that we have processed over 9,000 applicants, as well as a few more with a total of 12,000 of the initial license and renewal licenses and certificates. On the cyber incident, we have been working closely with DoIT since June of 2019 to be able to assist with putting all of the requirements in, actually really since 2018. During this time, we want to get to the cloud-based system. But one of my concerns right now is as we work with Do It, which is going to take approximately 3 to 5 years for our system for the Board of Nursing, we just want to have the opportunity to upgrade our current system, especially after the cyber incident, which will be in the cloud, and then we would not have had this particular incident. And what we can do with that particular upgrade is to have it linked to the one portal so that we will be able to move forward with that. My concern is our constituents, making sure that they have access. And because everything was internal, it was difficult for us to be able to do that. I do appreciate the MDH with paying for the cost of the Do It and assisting us with the temporary employees. But our biggest concern, and the reason why we were able to get those numbers down, is because I moved individuals from their roles because the community was waiting a long time for their license and certificates. But once you see when we do have adequate staff, we are able to process applications. So I think I hit my 2 minutes. So thank you so much, Mr. Chairman. I greatly appreciate this opportunity to speak with the committee.
Thank you. Since you were with the department, I was ready to let you go as long as you needed to. But there is a question actually for you from Delegate Valentino Smith.
Sure, thank you. Thank you, Delegate.
Thank you, Ms. Evans. Hi, and thank you to you, Ms. Elliott, Secretary Schrader, everyone who's realizing that nurses have been on the front line and have been really bringing us all through this pandemic. So my question is, if you're processing 9,000 and then you said almost 12,000, that's certainly Herculean. But what is the backlog then? I mean, what are we still looking at? If you're doing 9 and 12,000, is it that there's 20,000? Are we halfway, or where are we?
No, we don't have any longer backlog. We do have some paper applications, as Ms. E stated, and I wanted to get that number down because we were out December 4th. And so it was important for me for the agencies and license and certificate holders to pull my team off of their regular roles so that we are able to license and certify all those individuals. Now we're back to normal, but we're still down staff. And so right now what we need is staff so that we can not get a backlog. We're trying to avoid one altogether.
Thank you. I know I had a couple nurses contact me, and what you were allowing was reciprocity with, at least if they had the District of Columbia license, to be allowed to go ahead and practice. So thank you. Let's keep the nurses out on the front line, show appreciation, and help get you the resources you need.
Thank you so much. I appreciate your question.
Thank you. All right, any additional questions? Seeing none, that concludes the budget hearing for the Department of Health's Board and Commissions and the work for today. So I want to thank everyone for testifying, and we will see everyone again, I believe, on Wednesday.